Richard, thank you. We turn now to our health spotlight tonight and welcome in WISH TV medical expert and former Surgeon General, Dr. Jerome Adams. Doc, always good to see you. A couple of big medical notes, as you very well know, that we want to talk about today. First, monkeypox. Marion County now says it has its first 2 cases. The CDC lists 10 cases in Indiana, and you know this information. 4 of those added just this week. So how significant is this increase in cases, and is it getting enough attention, Dr. Adams?
Well, it's important for people to understand that we're going to continue to see more cases of monkeypox. We know that for all the cases that we're seeing, it's just the tip of the iceberg. But people don't need to panic. What they need to do is understand that this is a disease that's spread by very close person-to-person contact. It's predominantly impacted the gay community, men who have sex with men thus far. But we know that anyone who comes into contact with someone who has monkeypox is at risk. And that's why we want people to just be aware, not panicked, not concerned, overly concerned, but aware. And if you have a new rash, talk to your doctor, because there are medications, vaccines, and treatments for people that can help prevent monkeypox or to alleviate the symptoms of monkeypox. That's the key here.
Fair enough. On to COVID-19 now, Dr. Adams. The FDA just granted emergency use authorization for Novavax's vaccine for people over the age of 18. So what makes this shot different from the others that are available?
Well, that's a great question. We have the 2 mRNA vaccines that are available so far, Moderna and Pfizer. You have the Johnson & Johnson vaccine, which is no longer recommended. But what's new about this Novavax vaccine is it's a protein subunit vaccine. What that means is that it's made through traditional vaccine technology. And so it may be more accepted by people who are wary of the mRNA technology. It's also not been made from cell lines that were derived from aborted beetle cells. And so people who have a religious objection may also be willing to get the Novavax vaccine. Important to remind people that the Pope, that prominent Jewish leaders, prominent Muslim leaders all have said they are fine with their followers getting the mRNA vaccine. But this is a new option for the 10% of adults out there who are unvaccinated. And it's also highly effective, at least in preliminary studies, as effective or more effective even by a little bit than the mRNA vaccines.
Options are good, right? So we saw yesterday the White House release its new guidance on the COVID BA.5 variant. We've not seen a briefing, though, on this in a while and on the specific new variant. So what's your take from the White House's message, Dr. Adams?
Well, I and other experts have been calling on the White House to have a briefing to help people understand that we are seeing a rapid rise in new cases because this new BA.5 variant, along with the variant before it, BA.4, now compose about 80% of all cases. And we're starting to see hospitalizations go up in addition to cases. That's what the White House revealed yesterday. We're seeing hospitalizations tick up. So far, deaths haven't gone up yet, but we know that usually lags behind hospitalizations. Unfortunately, they didn't tell us much new about what they're going to do to respond to this. It's still pretty much on the individual. So to the viewers out there, please remember that there are steps you can take to protect yourself. And the number one thing that they talked about yesterday was getting boosted. Only about a third of people, adults out there, or people who are eligible for a booster, have gotten a booster. Yet we know that it lowers your risk of getting severe injury and death from COVID significantly compared to people who are unboosted and unvaccinated.
What are we looking at for the next couple of months, Doctor? More mask rules, social distancing, tighter rules on travel again? Your opinion?
In my opinion, I don't think you're going to see a return to rules and mandates, particularly here in Indiana. What I think you're going to see, though, is that cases are going to go up, hospitalizations are going to go up, and you're going to see flights delayed. You're going to see restaurants having difficulty staffing simply because more people are going to get the virus and get sick, which is why I tell folks, even when there isn't a mandate, I want you to understand the steps you can take to protect yourself. You can mask when you're around people who you're not familiar with, particularly with a high-quality N95 mask. You can get vaccinated and boosted, critically important, easy to do, and the most important thing you can do, especially now with Novavax as an option. Ventilation is key, being outside, opening windows. If you have symptoms, test, because guess what? We have a great treatment, Paxlovid, that's 90% effective at preventing you from going to the hospital even after you get COVID. And so if we use these tools, we'll be able to keep our society open I don't think it's going to be the government. I think it's going to be the virus that actually causes things to shut down in the fall if we don't all do our part.
I don't have much time left, Dr. Adams, but I appreciate you taking some time. I have one more question, though. The CDC issued a report on antimicrobial resistance yesterday. So why did they do that? And I know that you've talked previously. So what should people know about AMR?
Well, antimicrobial resistance is when our antibiotics stop working because we've been overusing them for things like viruses that antibiotics don't work for. The CDC issued a report yesterday saying that antimicrobial resistance increased by 15% over the last year. The bottom line is we've got to walk and chew gum at the same time. We've got to focus on controlling COVID, but we've also got to worry about mental health and antimicrobial resistance and missed cancer screenings and these other things that are going to impact our health moving forward. And we've got to understand that if we aren't more responsible about the way we utilize antibiotics, not demanding them for a simple cold, for instance, then we're not going to have these tools available in the future when we really do need them. And it could kill more people than even COVID has.
Good conversation as always. Dr. Adams, always good to see you. Thank you for joining us, sir.
Thanks, Phil. Good to talk with you.